Hi there, it's Richard in Newport once again, and today we're going to talk about shoulders. This is a bit of a preamble as to why we might do some rotator cuff strengthening when it comes to shoulder pain. Okay, shoulder pain is really common, and it can tend to be split up into three main categories: stiff and painful, weak and painful, and unstable and painful. And this bit of the video is going to talk about that weak and painful cohort, which a lot of people get put into really. Okay, first of all, you've got to understand what your rotator cuff does. Whenever someone gets shoulder pain, they hear that piece of jargon bandied around loads, and they're never really quite sure. Your rotator cuff is basically a sleeve of four muscles which keeps the ball and socket joint of your shoulder centered. Okay, and it gives you a reliable pivot for the powerful muscles to act off. So when you're moving your shoulder loads, okay, that rotator cuff is trying to keep that ball and socket joint in one place so you can move with efficiency. If it's not working or if it's not fit for purpose, what's going to happen is that ball and socket is the ball part of the ball and socket joint is just going to wander around a bit too much, and that could compress or stretches and give you pain. Okay, so what we're going to do now is give you a series of exercises which can help to improve that and hopefully keep your shoulders healthy. Okay, you may not have any pain, but train regularly or want to use your shoulders in overhead tasks like painting ceilings or things like that, in which case this can be quite a nice way to keep your shoulders healthy and keep them fit for purpose. So when you want to come and use them for different functional tasks, they're capable of doing that. Okay. Right, so the first exercise we're going to do is to get some weight going through your arm. Okay, if you put weight through your arm, then your rotator cuff tends to act together to stabilize your shoulder joint. Okay, so really simple exercise. All I need you to do is to get into all fours. Okay, we want a 90-degree angle at your shoulder and a 90-degree angle at your hip. I want your back nice and flat. I want your head tucked in. I don't want it drop down or looking up to the ceiling. I want it in that position, almost like you could hold a grapefruit or an orange underneath your chin. What we're going to do quite simply then is to start taking off one hand or one leg. Okay, so we increase the weight bearing through this shoulder. This is my problematic shoulder. Okay, so my hands flat on the floor, my knees and feet are sort of hip width apart. All I'm going to do to start off with is to take my good hand off. Hold it there for say 5 seconds or 10 seconds, then slowly lower back down. Okay. My back remains flat throughout it. I don't want any sort of sagging or doming. Nice and flat, and you maintain that nice central position throughout. So you're not sort of shifting your weight around backwards or side to side. It's just staying there and you're just taking it off, holding it for 5 or 10 seconds, and then back down. Now you might find your arms are shaking quite a lot. That's fine, okay? That's probably one of the reasons why we're trying to get you to do this, all right? If you find that really easy, then you can progress on to taking your leg off behind you on the same side as the shoulder you're looking to strengthen. Okay, so what you do then, you stay central, keep that nice flat back position, and then just take one leg off behind you. Doesn't have to be far, and then back down. Okay, when you do this, I don't want you sort of just cocking a leg, okay, and offloading the shoulder. We're looking to put more weight through this arm, so we just take that leg out behind us, holding it there, and back down. You should feel that you're getting more activity in your torso there, just to stabilize that shoulder, and that the weight going through this hand goes up quite dramatically. Have a go with that and see how you feel. Hi there. This one's a bit of a lazy one because you get to lie down on this one. Okay. very commonly when people get rotator cuff weakness, it's in this external rotation position. So we're going to just concentrate on that a little bit, okay? And it just helps you get some awareness of that cuff activation, all right? So what we're going to do, it's going to be quite a strict way of doing it, okay? We're going to lie on our side, okay? Head nice and supported, and your elbow into your hip, okay? Ideally, you're going to hold something in your hand. Now, I've got a ½ kilogram weight here, okay? Anything up to 1 kilogram is fine, but we don't want to go too heavy because we're trying to activate small muscles. If you get a too big a weight, all that's going to happen is your bigger muscles, like your deltoid or one of your big moving muscles, are going to activate, and we don't want that to happen. We want to keep them nice and relaxed, okay? So elbow into your side. Your hips and shoulders are going to be stacked, so they're on top of each other, okay? And all we're going to do is, from your hand will be on your tummy, and you're just going to lift up that hand, keeping your elbow in contact with your hip, okay? And we're going to slowly lower down. And again, you're slowly lower. This sort of pace is ideal. Hold it there, slowly back down. Now what you're going to find is that shoulder is going to start to burn probably after a while, okay? If you find that with ½ kilogram you can do 10 to 15 repetitions at this pace, that's absolutely fine. You might want to take up to 1 kilogram, but no more, okay? But nice and slow and controlled. Just getting that movement going, keeping that nice strict position, not rolling back, not sort of compensating for any lack of range you've got. Just do what you're able to do, but in that nice, slow, controlled manner. Okay, have a go at that and see how you get on. Hi, this video is a continuation of the series of videos we're doing for shoulder pain. Okay, the emphasis of this video is to try and get you moving efficiently, and in doing so, get an appropriate muscle activation both at your shoulder in terms of the rotator cuff and also at your shoulder blade, okay? So, because we're trying to look to you get into better starting positions and better finishing positions. The reason for us doing this is very often people stiffen up in their torso. Now, if I exaggerate and go into this sort of slouchy position, you can see I can't get my arm fully above my head. I need to extend my thoracic spine to be able to get that end of range elevation, okay? Which is really important if you want to do overhead tasks like paint the ceiling. You need this thoracic mobility. So this next exercise is quite a good way of encouraging you into those good overhead positions, and we use it a lot in the clinic. So if you can have something in your hand, that's great, because that helps get the muscles around your shoulder active. And I'm going to use a step, but you can quite easily do it on the floor as well to begin with if you're not confident doing this because your balance isn't good enough. So quite simply, all I'm going to do is step up and reach overhead, but the emphasis is very much on extending that back and encouraging that back extension with the shoulder elevation. So quite simply, I'm going to start with my hand in my shoulder, weight in the hand. It's only about 1 kilogram, nothing heavy. And I'm going to step up and reach, holding that position, holding that nice arch in my back, and then step back down and come back to this starting position. Okay? And we're just going to cycle through that movement a few times. We're going to step up and reach, keeping that balance, keeping that hip control, slowly back down. And again, we're going to keep on going, cycling through that movement, keeping this hip extended and back down. It's a really nice way to get you moving that hip, shoulder efficiently, okay, and getting you moving your body as a whole as opposed to just your shoulder, okay? Really important. Have a go, see what you think.